Traditionally, academic research focuses on identifying the causes of disease. Many of us who have been doing this for many, many years really try to understand cancer at the molecular level and at the pathophysiological level, essentially attempting to understand how do you go from a very early lesion to an advanced tumor, how does that tumor invade, how does that tumor spreads around and generates metastasis, and how does the tumor ultimately kill the patient. And what we realized over the years that because this is a complex undertaking, you really need to do this by providing a concerted effort to the problem. In other terms, you can't just have investigators working on their own and focusing on their own most interesting approach to the problem, and just really need to mobilize resources consistently and have some sort of an engineered approach. The great advantage about being here is that really there is great opportunity for integration of these activities with the clinical activities. So we really start from the patient, really start to understand, patient by patient, what is the nature of the mechanisms that are altered, and we can constantly go back and forth between the kind of science we do and the clinical science, really verify the hypothesis that we're trying to bring forward. In part of the failure or the low percentage of success in the clinic with new drugs is that this dialogue has been missing. A lot of good evidence comes from academic findings that describes the involvement of a particular mechanism in driving the disease, but what we don't know is by the time the disease has really become advanced and there are many, many mutations that have occurred, is that particular mechanism still required? So one of the first questions we ask when we go in and start engaging in this project, we have a team that really will work on trying to disprove the academic findings. Here at MD Anderson, I mean, the culture is fantastic from the point of view of collaboration. People are incredibly friendly, are engaged. The clinicians, despite the fact that they're very busy, are always ready to open their doors to talk to you about the challenges in the disease. And it's really been incredibly motivating for us to be here.